Okay, so we're going to do a peripheral vascular assessment. So I'm going to start out with the upper extremities, and then we're going to do lower extremities. So for upper extremities, I'm going to be looking at the patient's arms, looking for any abnormalities, any cysts, looking at the hair pattern, any discoloration or pigmentation of the skin. I'm also going to go through and check for skin temperature. So I'm just going to use the back of my hands on both arms at the same time, just checking all the way down to your hands, just making sure that she doesn't seem to be having a fever or there's one spot that's colder than the rest. Then I'm also going to go through, and on a normal patient I'd be doing a nail compression test and compressing the nail down and making sure that there's a good blood flow going back into the nail. But in this case, her nails are all done up and colored red, so you wouldn't really be able to tell for that test. And then you can also go through and do a tissue turner test. So you'd be pinching the skin and making sure that the skin goes back to normal. And for older patients, it would be a little bit slower, but for her being young, it goes quickly back to normal, which is a good sign. And as we go through, I'd be taking bilateral radial and ulnar pulse, so just making sure that they are same rhythm, rate, and amplitude. Good, and she has really strong radial. Then I'll check ulnar. And that one's a little bit harder to feel, but you can still feel it. Then we're going to go through and do brachial. Good. And then we're going to do Allen's test. I'd be doing this bilateral for both arms, so I'm going to pinch down on radial and ulnar artery, and then can I have you pinch your fist really quick and open it back up, do it fast. Good. And now make a tight fist. Bring your arm back down. And I let go of the radial artery, making sure that blood flow comes back to it, and same thing with the ulnar, and looks normal, which is a good sign. So then I'm going to go through and check all the different lymph nodes. So I'm going to go to the epitrochlear node, which is going to be up on the bicep, in between the bicep and tricep muscle, and just making sure that there isn't any enlargement. Feel this? I think I can feel part of it. Okay, and then checking the other side. Okay, and then while my patient's still sitting here, I could either have her sitting or laying down, but I'm going to check the rest of the lymph nodes in the axillary. So I'll be feeling up into your armpit for different lymph nodes, so just go ahead and relax your arm. So for the anterior, I'm going to be feeling up in front and on her pec muscle. And then for lateral, I'm going to have my palm of my hand on her humerus. Go ahead and just relax your arm down. And I'm going to be feeling on the lateral aspect towards me. And then for the posterior is going to be back by the traps. And then for medial is going to be the palm of my hand on basically the side chest wall. Good. And that'll be it for the upper extremity. And then going down to lower extremity, it's going to be kind of the same format as I did with upper extremity, looking at the skin, seeing for any abnormalities, whether there's skin pigmentation or swelling, edema in the ankles, looking for different hair patterns, and everything looks pretty good. And like I said before, with doing a nail compression test, she also has her toenails done, so I wouldn't be able to do that test, but normally I would if I was able to on a patient. And then while I'm going through, I can also do a leg pitting assessment, so be pressing on different areas of the leg, making sure that there isn't any pitting when I press down on it, and making sure that the skin is staying tight and not leaving an indentation. And then going through further, gonna feel pulses, so I'm gonna start with the dorsalis pedis. I'm gonna be doing it bilateral at the same time, so I'm gonna be on the dorsal part of her foot. Good. And then I'm gonna go through and do the posterior tibialis. Same thing, going bilateral. Okay. And then after that, I'll be doing the popliteal, which this one is going to be more or less having to be done one at a time. Can I actually have you lay back? Good. Okay. Just go ahead and relax your leg. Good. And then the other side. Same thing, just be checking for that. And then the last one that I'll be checking for is the femoral. So for the femoral, depending on whether I have a male or female patient, gonna want to have a border between any of the private areas. So for a male, I'd be asking the male to be covering his genitalia, and I could do the same with females, just so there's a barrier between my hand and the genitalia. So can I just have you cover your genitalia for me? Mm-hmm. Okay, and then I'm just gonna be sliding my hand. Could you actually pull your shorts up to about the crease of your leg? So I'm just gonna have my fingers just on the inside of your leg, feeling your femoral artery. And I would be doing this bilateral. Ticklish. Mm-hmm. Okay, good. And then also while I'm here, I'll be doing auscultation and using the bell side of the stethoscope. And I can't hear anything, which is a good sign. And on a normal patient, I'd be doing this bilateral. And then also for, which I could have done earlier while I was doing the skin pitting, I could test for temperature. So go ahead and lay back down. And just checking, making sure that there aren't any excessively warm or cold spots. And it should be getting a little bit colder the more distal I'm getting from the main part of the body. And also I'll do a hernia check. So same thing, gonna have my hands in on your inner thigh. Okay. And I'm gonna have you turn the other way and cough for me. Okay. Go ahead and cough. Good. I don't feel anything pushing down on me, which is a good sign. So no hernias. And then for a Homan sign for a deep vein thrombosis, I'm going to lift up her leg, and if there's any pain right away with this, I would just immediately stop the test. But if there isn't, then I would dorsiflex her foot and I would squeeze her calf. And you have any pain with that?
No.
So she has a negative sign for any deep vein thrombosis. Oh, excuse me. And then also I can go through and do a leg elevation test. So I'll be taking both legs bilateral, and then can I have you kick your feet like you're swimming? Your feet, flap them. Oh. There we go. And I'd be doing this for about a minute, and after about a minute's up, I will have my patient sit up and have her legs over the edge of the table or wherever she's at. So, and sit up, bring your legs over, and I'm making sure to look at her legs and the tops of her feet to make sure that there's a good blood flow coming back into the area. And then lastly, could I have you stand up for me? Is a venous tap test. So I'm going to be feeling up high or feeling down low and tapping high, feeling for any movement of blood that's coming down that could be trapped from a vein. So that's about it. And yep.